Azra went with her father, Mr. Sinar, to his doctor. The doctor suspects that her father has dementia. But to be sure, he referred her father to a neurologist, a specialist dealing with diseases of the brain. The neurologist asks Mr. Sinar what difficulties and changes he has noticed recently. The doctor also asks Azra the same questions. The doctor then gives Mr. Sinar a little test. She tests his memory, his thinking ability, his speech, and his perception. By testing his blood and urine, the doctor can tell whether Mr. Sinar's memory problems may be caused by another disease. For example, by a problem with the thyroid. Depression can also lead to memory problems. Computer tomography can determine whether there are any changes in the brain. Then, finally, the doctor is certain. Mr. Sinar has early-stage Alzheimer's disease. The diagnosis is a hard blow for Mr. Sinar and for Azra, but they are also encouraged now they finally know the reason for the changes in Mr. Sinar. Azra wants to know how dementia can be treated. The doctor explains that there is no cure for dementia, but there are medications that help to delay the illness. These drugs are called antidementives. Ms. Sokolov has had dementia for a longer time. She is sometimes very anxious and finds that troubling. And that's why she has been taking neuroleptics for some time now. These are medications that help with restlessness, anxiety, or delusions. But sometimes different therapies work better than tablets. For example, logopedics help with speech problems. Physiotherapy or ergotherapy helps a person to remain independent longer in their everyday life. Music can reach many people with dementia and lift their mood. Painting or sports help out. Looking at photos together helps train the memory. It is important that persons with dementia participate actively in life. This helps them to stay mentally and physically fit. Azra and her father decide to look for a consulting center for dementia. They can find some help with the Alzheimer phone number of the German Alzheimer Association. At the consulting center, Mr. Sinar gets a lot of important tips. He finds out where he can get additional support. The dementia counselor tells Azra how she can better help her father. The counselor also recommends that she attend a group meeting for family members of people with dementia. Here she can meet with persons in similar circumstances. Azra thinks this is very helpful. Azra doesn't feel so alone anymore. She feels more confident to handle the new situation.